Thank you. Thanks very much indeed. And it's good afternoon. I think it's just afternoon now. I'd just like to thank Laura and Stephanie and the other organisers for giving me the opportunity to be here today. Often at the meetings that I go to, I'm kind of the only person talking about the interconnections between environment and human health. But of course, we've had 4 absolutely excellent talks this morning that have said pretty well all the things that I would normally say. So my little contribution today is going to be much more about throwing ideas out and trying to give some different perspectives on the interconnections between the environment and human health, and where we might go, how we might think of developing this whole area as we go forward. In particular, I think that it would be nice if we can change the perspective that people in Western Europe have about the environment and human health. A small ambition, but I think it's something that maybe we can get going. And it seems to me that Ireland and hopefully the UK as well are 2 places where there is an appetite to make these kind of changes. As Jock pointed out, I am an aging professor, and I've been messing about in the area of environment and human health for almost 40 years. I started life as a marine biologist and then meandered into medical research, working on leukemia and so on, and I've been working backwards and forwards between the 2. But my ambition when I left being chief scientist of the Environment Agency in the UK was to bring together all the things that I'd learned to try and create an interdisciplinary centre, hugely important to tackle this in an interdisciplinary manner, and to bring together an interdisciplinary team to look at the intimate interconnections between the environment and human health. And in order to do that, we have to consider the threats from the environment to health and well-being, and that's typically what environment centres do, but also to look at the opportunities the environment provides to foster improvements in health and well-being. So I'm going to say a little bit about that today. So benefits, more than one, I think it said benefit in the program, but benefits of a clean environment. Let's kind of meander through and see what we can find out about how the environment influences what we do. This is my favourite slide that I kind of show in nearly all presentations, and it's really to make the point that during human evolutionary history, if you look along the bottom scale, it's time. Over the last 80,000 years that they've been human beings, they've been living in intimate contact with nature. They wake up in nature every morning, they live their lives in nature, and they go to sleep in nature. And actually, from that time, let's say 80,000 years ago, but maybe some of the positive recognition of humans as being human beings was perhaps 40,000 years ago when you see the first cave paintings and those sort of things. Those people were, as I say, living in intimate contact with the environment, and there were about 500 million of them on planet Earth. And you can see that that went all the way through, right up until actually 1804, when there were 1 billion people on the planet for the first time. Now, for most of that time, one could argue that the environment was clean. It wasn't heavily impacted by industrial pollution or pharmaceuticals leaking into the environment, or any other kind of environmental contamination due to man, although clearly there'd be natural toxins and hotspots of metal pollution naturally occurring. So really, the concept of a clean environment is something that's really emerged with the modern development of humans, really in the last couple of 100 years. And it's taken quite a while, I think, to really get into the general parlance of the medical and health communities that the environment really, really is hugely important for health and well-being and in the avoidance of disease. If you'd asked the question, how important is the environment in influencing the diseases that we get across the life course 10 years ago, you'd have been told that, well, maybe about 40% of the diseases that we get and the illnesses we get in our lifetime are due to environmental exposures. And the rest of it, though, is kind of embedded in your genes. It's determined through your genetic makeup. But now I think we have a much clearer idea that it's at least 75% of the influence is from the environment, perhaps through the epigenetic effects of environmental stresses, chemicals and so on gene expression, and 25% is kind of the congenital abnormalities and so on. So here's evidence that things are moving along and that the environment really is now being recognized as an incredibly important factor in our health and well-being. The other thing I'd like to kind of point out is that the diseases that people have these days are very different to those that were around just over 100 years ago. So the column it must be on your left, 1900, those were the kind of diseases that people were getting. And there were about 1.5 billion people on the planet at that time. And if you look at the column on the right, in 2010, those were the prevalences of diseases. Quite a major change in pattern. And there were about 7 billion people on the planet then, perhaps just over that. And the issue for me that I think we ought to be thinking about when we're considering this whole area of environment and human health is what next? What will the pattern look like in another 20 or 30 years? And what role will the environment have played in it? I was talking to Jock earlier, and we were discussing the fact that the European Union, European Commission, has run a number of workshops where they've looked at future scenarios for Europe. What will it be like? What would happen if we had a sort of a business-led economy and community and attitudes of, drive business forward, compared with an environment in which we were much more altruistic and shared things much more, and all these different kind of scenarios. So the EU looked at that, and actually nearly all the scenarios ended up as looking quite horrible. But what it didn't do was think about the vision of what kind of environment we would like. And so I really think that I'd like to propose that we think about creating a manifesto for the future environment of Europe, and indeed perhaps more broadly the future environment of the world, in relation to health and well-being. And in a way, the Sustainable Development Goals are part of that journey, but they don't really articulate very clearly, in my mind anyway, what kind of world we would really like to live in, what are we aiming at, and what kind of policies do we need to have to deliver that world. Now, I mentioned the whole issue of what can the environment do for you. It's not just about threats. I'll deal with threats a little bit later in this talk. But what can the outdoors actually do for you? I use the word outdoors to really avoid having to get into definitions of what green space, blue space, white space, and any other space are. But once you're outdoors, you're outdoors. And I think that there are automatically a number of benefits that you get. For example, when you're outdoors, you tend to be walking around a bit more, you're moving around a bit more, you're using more energy, and consequently, you're reducing your risk slightly of becoming obese and overweight. When you're outdoors, especially in green and blue environments, you're getting much more mental stimulation. And we know that this reduces the risk of psychiatric disorders and other kind of mental health issues. And there's not many of us, I should imagine, in this room that when you're feeling really, really stressed out and anxious, that if you go for a walk in the park or on a seashore or in the forest, you usually feel a bit better, don't you? And so I think these kind of things are built into our makeup, and certainly it's more evidence that the outdoors benefits us. If you do enjoy being outdoors, then it keeps motivating you to keep going outdoors and doing some more. So you can develop beneficial habits that keep you moving and keep you in contact with psychologically beneficial situations. And usually when you go outdoors, you go with other people very often, go for a nice walk together. So it builds social cohesion. And in terms of economic aspects, you don't need a lot of money to be able to go outdoors. Most people can find some access anyway to a green or a blue environment, walking by the side of a canal or walking through a park. Not everyone, but most people. And there are an increasing number of scientific studies. 10 years ago, when I set up the European Centre for Environment and Human Health in our University of Exeter Medical School, I hired a guy to work with us called Dr. William Bird, who's inspirational. I don't know if any of you know him, but he created a thing called the Green Gym, in which he was getting his patients to go out into their gardens at home and mow the lawn and prune the roses and just be outdoors, and tried to capture the evidence that this was beneficial to their health. And these green gyms, as they were called, became formalized and set them up all over the UK and in other parts of the world. The interesting thing about green gyms, though, was that the studies that were done to capture the evidence it genuinely improved health and well-being were not very good. And indeed, 10 years ago, the whole evidence, scientific evidence that the natural environment is really, really good for you, was very, very poorly put together. Very poor studies. And so when you go along to government and say, well, I really think that we ought to foster the use of parks and green spaces and forests and access to nature, government would turn around and say, yeah, but where's the scientific evidence? We can see from the drug companies that we can help people over depression by giving them various pills, but we can't really see robust scientific evidence that sending them out for a walk in the park is going to reduce their mental health problems. So one of the things we did was we've set about, as many other people have done, in trying to get that evidence, and this was just a study that you can see before you, where we looked to try and see in a very robust way whether outdoor exercise is better for you than indoor exercise of the same amount. And we found 384 scientific papers within the last sort of 5 or 10 years, and we compared them in a very rigorous way with a set of criteria that would tell you whether these studies had been done well, whether they were biased in any way, whether they had the right statistical power to be able to say anything at the end of it. And out of the 384 studies, we found 11 that had been done well enough to be considered science. And those 11 did demonstrate that there are some psychological benefits to doing your running outdoors compared with doing it in a gym. Didn't tell us anything about whether it helps with tackling obesity in a robust scientific way. So my point is here that to do systematic reviews of scientific evidence, that's the procedure I just described, is very, very important. If we're going to make the case for the benefits of the natural environment to health and well-being, then we need to do incredibly robust science of the same quality that is done by the drug companies and those offering other kinds of cures or treatments or preventative measures. And we've cracked on and done a whole load of this. This was a study trying to look at the benefits of different kinds of environments in terms of reducing stress, spending time in there. And we certainly found out that green environments and blue environments seem to be perhaps the most powerful, the most effective. The recent study that we've done, the most recent study we've done, was looking at physical activity in natural environments, because we know that an increased amount of physical activity benefits your health and reduces your risk of all kinds of things, including diabetes, cardiovascular disease, and so on. So this study is a population-based cross-sectional study in England. The idea was that to see where adults do their recreation and to see to what extent the natural environment in England is a place where people do their recreation. So we did a cross-sectional analysis of 6 waves of a national representative sample from this MENACE survey, that's monitoring engagement with the natural environment. And we had 280,790 people in it. And looking at weekly quota samples and population weighting and so on to estimate the number of visits they make to nature. And we had details of the kind of visits that they made, including how much time they spent in these natural settings when they're outdoors, how much activity they did there, what kind of activity, and what the environment was like. Was it heavily wooded, or was it an open park, or whatever it was? So we looked through all this, and on a population level, UK population level, we reckon that 8.23 million adults, that's about 20% of the population, made 1 or more active visits of duration more than 30 minutes to natural environments during any previous week. That means it's about 1.23 billion active visits to green and blue spaces during a year. So 3.2 million people, we think, in the country, based on these sampling procedures, also met the recognized physical activity guidelines, which are that you should do 5 times of 30 minutes exercise per week. So this access to nature was facilitating people meeting their basic exercise requirements. And there are things called QALYs, quality adjusted life years, that many of you will know about. And these active visits seem to be associated with about 110,000 QALYs annually. And since a QALY is meant to be worth about £20,000 annually, that means that providing green and blue spaces that people can go and do their physical exercise in actually saves about £2.18 million a year. So this, I think, is the kind of evidence that if you want to convince economists and government officials and so on that the natural environment is worth something, this is the kind of route that you might want to go down. So natural environments do provide these opportunities for a large proportion of the British population, the English population, for recreational physical activity, and I think it just highlights the need to protect these kind of areas. One of our obsessions in southwest Britain, in the centre, the European Centre for Environment and Human Health, is water, because we're surrounded on 3 sides on the southwest peninsula by water. And as I say, I started life as a marine biologist, so I'm really interested in water. And all my staff seem to be surfers, so we do water. And one of the things we did was another survey with Natural England, and we had the postcodes of people, and we had their self-reported health in relation to their postcodes. And when you plot it out like this graph shows, you find that people's self-reported health is much better if they live within 1 kilometre of the coast. Not only that, we found that people from the lower socioeconomic groups, that the differential between their self-reported health if they lived in Birmingham compared with living on the coast was much, much greater than wealthy people. So if you're wealthy and live on the coast and wealthy and live inland, your self-reported health isn't that much different. But if you're poor and live in Birmingham, away from the coast, and poor and live on the coast, your health is much better if you live on the coast. And we know that self-reported health correlates very well with your actual health. So I think this is a pretty interesting indication. This whole idea of looking at coastal environments actually goes back a wee bit further. I started a program back in 2008 called the Blue Gym, which was helping to foster the use of coastal environments for swimming, sailing, surfing, kayaking, anything else you could think of to do with the coast among socioeconomic groups that would not typically do that kind of thing. And then we were trying to see, does that reduce the number of visits people make to the doctors? Does it reduce the amount of pharmaceuticals that people use in a year? So that's where Blue Gym started. I actually regretted calling it Blue Gym because that implied that we were going to be athletes or sports people. And I think we have to get away from that. What we're really talking about is just getting people to be outdoors and a little bit more active. We've now moved on. We have a program called Horizons 2020, Blue Health, so it's funded by Horizons 2020, and it's to develop intersector interventions and or policy initiatives to promote health and prevent disease in relation to known environmental stresses. And we've got about 14 countries involved in that, and I'd be happy to tell people more about it. But there are about 194 coastal cities around Europe, and we're extremely interested to know what threats are being posed to those cities, to people's health and well-being, and what opportunities there are to improve people's health and make them more resilient as they live in those European coastal cities. And indeed, this project has now gone global because we're collaborating with people in Hong Kong, up in the Arctic, and I just got back from Tasmania, so I'm slightly jet-lagged, and we're going to do studies down there as well. One issue that did drift by us this morning was this whole issue of inequality, and the picture in the top right you can see is actually the village where I live, and some people have access to those sort of places on the top, and some people only have access to the places shown on the bottom line. And I think this whole issue of inequality must be one of our key priorities that we wrap up in the whole environment and human health agenda. We know, and this is very old data, but there are lots of studies showing this, that when people feel hopeless, if you measure degrees of hopelessness and look at that in relation to the disease they get, then the more hopeless you are, living in those horrible environments with little access to nature, with a bad diet, with exposure to air pollution, contaminated land and so on, you're much more likely to get cardiovascular diseases, a range of other diseases, cancers and so on. So we know that. So there is really an agenda, I think, to pursue about what kind of ecosystems we want to have these days. And in the UK, at least, we've not had that discussion. We talk about wanting to conserve nature. We talk about wanting access to natural ecosystems. We talk about aesthetically pleasing ecosystems for tourism and so on. But we have no plan about what kind of ecosystems we want, in what proportion, where we want them, who has access to them, what the benefits are, what the economic implications are. So I really think that that's something we should proceed more with. I'm rapidly running out of time, but I did want to just tell you about some new flavors that we're trying to introduce. One of them is the use of social media. So in order to find out what people's perceptions are about the environment and about the environment in relation to their health and well-being, we want to start using social media, and indeed we've been doing that. You can look at Twitter, but it's much better to look at blogs, and there's a range of things that you can do. You can look at where people have been spending their time through looking at their use of credit cards and how they use their mobile phones. And I already feel uncomfortable saying that in this room, because this data that's out there is personal data. And even though you can't necessarily identify individuals, it's still personal data. So there's some deep national, international debate we need to have about how we use data. But nonetheless, most of the major international companies in the world are using this data right now to plan what they're going to sell you in the supermarkets next week. So, and when they get these messages, these tweets, these blogs, they're using natural language processing, which can reveal a huge amount of information about what your intentions are in terms of where you're going to be, what you want, what you need, what you're going to buy, whether you're going to have a barbecue on Friday night, whatever it happens to be, you can glean that from these messages. But what we've been trying to do is, working with a commercial company that was called Black Swan, we've created a not-for-profit charity called White Swan, which is somehow poetic. And the object of White Swan, not-for-profit, is to use big data of the kind I've been talking about to foster improvements in health and well-being. And now this example isn't terribly environmentally related, but it is one example where we've shown that this can work. So what we were trying to do with this study was to predict who would turn up at accident emergency in hospitals on the day before they actually turned up there. And we've actually been able to do that with 86% accuracy in a hospital in Birmingham. And we're trying to try this out in other places now. And we know that a lot of those admissions were due to flu and pneumonia admissions, some to trauma, and some to alcohol poisoning. It's really interesting that when people get drunk and hurt themselves and end up in accident and emergency, first thing they do is tweet and say, "I'm in hospital, I'm pissed, I've hurt myself," which is slightly alarming. But anyway, they do that. And so we've been looking at that kind of information and can predict with, as I say, great accuracy what's going on. And we can look at other factors, like we can look at seasonality, we can look at what the climate's doing. And when you do that, these are yearly trends that you can find out from this kind of information, looking at who goes into accident and emergency with what at different times of the year. And you can see, with flu in the winter months, flu's going up. You can see with trauma, it's more in the summer. And you can see what's happening with alcohol poisoning and so on. So the overall idea of this social marketing to foster improvements in health and well-being in a not-for-profit way is to try and create the first and biggest patient-generated health library in the world and relate that to environmental quality, to climate, to changes in the environment, to what people are thinking about the environment, what they're intending to do in it, what benefits they get from it, but also the physical things like what's the pollen count doing to their health and well-being? What's the weather doing to their behaviors? Are they spending less time outdoors if it's raining more? Or are they outdoors more if it's warmer with climate change and so on? So I think this is a really interesting area to pursue. We've also been looking at pro-environmental behavior. It seems that when people spend more time in nature, in natural environments, they get to care more about that nature. They start being more receptive to environmental messages and look after things more. But I think the opposite is also interesting to explore, so I'm interested in looking at contra-environmental behavior. If you put people in cities, and 85% of the UK population now live in urban environments, then do they start to care less about nature? Do they just chuck their rubbish down? Do they not bother about birdsong? Do they not want to see animals? We don't know the answer to this, but I think it's an interesting research agenda. And then there's communicating all of this, and we've played around with it, and this is my favorite example. This was with one of my former postdocs, Will Stahl-Timmins, and we kept seeing all these adverts for drugs, for tablets that would cure you of this, that, and the other. So we thought, couldn't we put nature inside one of these pills and advertise it? So we invented this drug, Salutagen, which is all beautiful sunny spaces by rivers and so on. And it lowers your blood pressure, it lowers your heart rate, and it promotes well-being. And it's available from all parks, seashores, forests, countryside near you. So I think there's a public engagement issue that we have to make a step change in what we actually do. Things to guard against. Nearly everyone in this room, I guess, wants nature to be beneficial to us. And that's fine, but that isn't science. So I think what we have to do is put our feelings aside and really adopt the null hypothesis, which is nature doesn't benefit you at all, and try and prove that nature doesn't benefit you at all. And if we happen to find out that we're wrong, great. But I think that's the way to think about it if you're going to do really good science. I think we need to think about nature in the context of other things. If you like shopping, and you go and walk around the shopping mall a lot, are you getting enough physical exercise? Are you doing it with friends? Are you getting mental stimulation? Is that better than going for a walk in the park? I hope not, but it might be. And until we do the studies, we don't know. And failing to recognize that different cultures in the world also have different ways of perceiving nature. And as I say, I'm just back from Australia, and the Aborigines do not get a distinction between the environment and human health. It's just not part of the agenda. And I suspect that 500 years ago, people didn't think of the environment as being separate from themselves. It wasn't a government department 500 years ago. It was just intimately involved in their lives. And what I would like to do is see if we can get back to that kind of arena. Very quickly, I'm going to race through a few slides about what are the consequences of losing the attributes of these clean, nice environments. And I think they're these. The planetary boundaries idea, many of you will know about, which is where if you take things like biodiversity, climate change, and put them outside of limits that allow people to live in a safe operating space, then we get into all kinds of trouble. So part of our job is to keep families safe in this safe space for living. The point is, it's not enough. Because if you look at human boundaries, even if you're in a safe place from the point of view of environment, if you have a lousy family life and a lousy working life and you've no hopes and aspirations and your physical health's gone off, then your human boundaries are really limiting you too. So I think this is just another way of framing the idea that as well as having a safe, healthy environment in which to live, we need to pay a lot of attention to how people are living within it and how it affects them. Climate change, massive effects, huge number of things to impact on us, and we know that climate change is probably the biggest threat to health and well-being in the 21st century. That's about losing a safe space to live, but lots of co-benefits of dealing with climate change. I wanted to rush on to this though. This is a chemical array that we are exposed to: pesticide, fertilizers, industrial chemicals, pharmaceuticals, gases, particulates. At the moment, I think we have an inadequate system for dealing with these complex mixtures of chemicals that accumulate in our bodies. This red spot in the middle represents global chemical production in 1940. How many dots do you think would represent global chemical production today? That many. We didn't plan that, that's just happened. What will it be in another 75 years? Heaven knows. We need to think about these things. Jock talked about the European biomonitoring program. I've been talking, as with many other academic colleagues, about body burdens of environmental chemicals for many years. Pharmaceuticals in the environment, another massive problem. Once you're over 50, your pharmaceutical use goes through the roof. You're talking about an aging population in Ireland. Guess what? Pharmaceutical use in Ireland is going to rocket as your population ages, and many of these drugs will be peed and pooed into the environment through the sewage system. I better make this my last slide. I just wanted to point out, though, that we have an infrastructure for health and well-being. Sorry, an infrastructure for health. Actually, it's an infrastructure for treating disease. And we have all of these things. We have surgeons, we have pharmaceuticals, we have experts in chemotherapy, radiotherapy, all of these different things. And all of those things are done to you by experts to make you better. Health is a different thing. You have to do it yourself. You have to have a healthy diet, physical activity, time spent in nature, all of those things on the left side. Quite a lot of medical things are damaging to the environment. It's one of the greatest sources of radiation in the environment, for example. And we're pumping pharmaceuticals into the environment after they've been through our bodies. But our health depends on there being good environmental quality. And what I'd like to finally argue is that, well, public health agencies are really working hard on the health side of this equation, which we've neglected massively. Only 3% of medical research budgets are spent on health, on preventing illness. 96% are spent on treating disease. So, this is a big issue for us. And I think in future, we're going to have to develop an infrastructure that fosters improvements in health and well-being, preventing illness, that's similar but different to the infrastructure we have for treating disease. So I'll stop there. Thank you very much.